So depending why someone is in the hospital, they may temporarily need to stop taking the oral medications that they need for their diabetes. Because in the hospital, very often meals are disrupted. The patients are told that they can't eat or drink because they're having a test or a procedure. Also, if the patient is there and there's any risk of kidney dysfunction or liver dysfunction or heart failure, then there are certain oral medications that they can't take. With insulin, we don't have to worry about any of those things. Plus, with insulin, it's much easier to start and stop than oral medications. So let's say someone's on, I don't know, let's say glipizide, and they should take that in the morning. If at 10 a.m. doctor comes around and does rounds and says this patient needs an abdominal ultrasound and has to be NPO, well, there's no sucking the glipizide back out of them. But if they are on short-acting insulin, then that only lasts for 4 hours, 4 to 6 hours. And so if they decide at 10 o'clock that patient's not going to have lunch, then they just won't get a lunchtime dose. And I don't know why they would treat someone as if they have hypoglycemia if their blood sugar is normal as in the 70s, unless the patient is symptomatic. I mean, the patient has no symptoms and it is mealtime anyway, then I would just recommend letting them have their meal. I don't think they need to be given any additional carbohydrates. Our hospital hypoglycemia protocol starts at below 70.